you today?
Good.
Good. My name's Emmy. I'm the nurse here. Can I talk about why you're coming in today?
Yeah, I'm coming in today because I'm trying to quit smoking. I'm going to start looking after my grandson a lot more while my granddaughter is at work, and I just really want to kick the habit.
Okay. What has your smoking pattern been like?
So for 20 years, I smoked a pack a day, so I smoked quite a bit, and then I've been trying to kind of taper down, and I've been smoking e-cigarettes for the last 6 months.
Okay. So just to talk a little bit about cigarettes and the side effects that come along with them. As you may know, the risks include lung disease, cardiovascular disease, loss of sight or smell, can cause taste problems, cancer, type 2 diabetes, immune dysfunction, and a lot of these could be life-threatening. About 500,000 people die every year from smoking. And then you also mentioned e-cigarettes. One of the common misconceptions is that it's healthier for you. And part of the problem is there's just not enough current research on it to really tell, but one benefit is it does have a little bit less, you can choose to have less nicotine, so that can kind of be helpful for people who are trying to wean off and not be as addicted. But it's not FDA approved by any means. It does cause similar health issues, and also the combustible agents in it also cause chemical burns and problems, so can be just as dangerous. What kind of ways have you tried to quit smoking in the past?
Well, like I said, I've just been doing the e-cigarettes for the last 6 months. I really haven't tried to do too many alternatives to smoking, but I didn't know that there were so many risks to the e-cigarettes too.
Yeah, I can understand. So let's talk about the different options for kind of assistive measures to quit smoking. So we have patches, chewing gum, nebulizers, lozenges, things like that to kind of help you. One thing to be aware of is a lot of these do have some side effects. The way that they act is they mimic the nicotine receptors in your brain, so it just kind of gives you that initial high that you get from nicotine. But it can include, the side effects can include high blood pressure, dizziness, insomnia, irritability, but irritability is another thing to keep in mind when you quit smoking. A lot of people experience pretty intense irritability with that. It can cause loss of appetite, indigestion, nausea, vomiting, hiccups, and a cough, things like that. Do you have any questions about those?
Yeah, it sounds like there are some risks or side effects to those, but are there any other options?
Yeah, so to let you know, that does have side effects, but not everyone experiences those side effects, and the FDA states that these side effects are not serious or life-threatening, so there's not super dangerous side effects to those options. But another option is called bupropion, and it is an antidepressant, so it kind of mimics those serotonin and dopamine receptors in your brain, kind of those like feel-good receptors. But one thing to keep in mind is that it does act as an antidepressant, and it does have similar side effects. So to watch out for suicidal or homicidal tendencies or thoughts. You shouldn't take it if you are on MAOIs, or if you had a risk of seizures or serious nutritional imbalances. And it is a 12-week program, so you can smoke for the first week of the 12 weeks, but if you haven't quit smoking by week 2, I would definitely contact the provider. We can kind of work with you to see if there's something else that should be added, or if we should work on weaning you off. It is definitely a medication that you do want to wean off of, like any other antidepressant. We don't want you to stop cold turkey. So even if you're experiencing some slight side effects, definitely call the provider. We can talk about the next plan of action. Do you have any other questions about that one?
I don't have any other questions. I think the nicotine replacement therapy kind of sticks out to me so far as something that I want to go towards.
Okay. And so let's talk a little bit about your environment. Do you have anybody that smokes at home as well?
Yeah, my husband has been smoking basically for the same amount of time, and that's kind of made quitting hard because that's something that we kind of do together and we do in our house, so that's made things harder to quit throughout the years.
Yeah, I understand. Have you talked to him about possibly doing the program with you, putting together?
He's intrigued. He says he wants me to start, and then we can kind of, if he's saying that it's really impacting me in a positive way, then maybe he'll join me, but for right now he's still smoking.
Okay. So having that be around you is definitely going to make it more difficult. So if possible, if he can have a different place where he can smoke, so that it's not in front of you and kind of making you want to smoke, that would be better. Or if he can just not smoke around you in general, like not smoke at the home, not smoke outside of the home, if that's possible. But I understand that's pretty difficult to have happen. But let's talk about, do you have any other questions about that, your concerns with him?
No, I think that sounds like a good idea of having him go somewhere else in the house, and that might kind of cut the cravings down a little more for me.
Okay. So just a little thing to keep in mind too is that a lot of times when you experience a craving, it only lasts for 20 minutes. So if you can kind of push through that, that helps a lot. Quitting smoking is very hard. A lot of people struggle with it a lot. An option is cognitive behavioral therapy, where you would work with a therapist to kind of analyze the thoughts and feelings and your reactions, kind of your behaviors around smoking to kind of improve that way. It's a non-pharmacologic method. Do you have any questions about that one? Or
that one sounds intriguing.
Yeah.
I've never really been a therapy person, but like I said, I'm willing to try anything. I want to be able to watch my grandson grow up.
Right, I understand. And that's also definitely something that we can use in combination if you wanted to do a patch or one of those other therapeutic methods. So it is important to quit smoking. It definitely will increase your overall health. And I'm glad that you came in today. Do you have any other questions?
No, so I think I'm gonna go towards the nicotine replacement therapy with the patch, and definitely get my husband smoking outside of the house. And sounds like I'm willing to try the cognitive behavioral therapy and see if it works for me. And thank you for giving me all this information.
Yeah, of course. So just give us a call back and we can set you up an appointment with a physician that'll be able to give you a prescription and also refer you to a psychiatrist that will help with the cognitive behavioral therapy aspect of it. And we look forward to working with you. I'm very excited.
Alrighty, thank you.
Yeah.